Good day, ma'am and sir. I am Rob-Denzel G, Suliguin, a student nurse and your future RN. Today, I will be demonstrating a head-to-neck assessment. But first things first is we need to prepare all the materials needed. Make sure our hands are clean and the environment of you and both of your patient is secured, safe, and privacy is maintained. And now, let's proceed to the head-to-neck assessment. Before we proceed to the actual procedure is we need to introduce ourselves and as well as the patient, and we need to tell the patient what procedure are we going to do. Good morning, sir. May I know your name, sir?
I am Rob-Denzel G. Suliguin.
Mr. Suliguin. Hello, Mr. Suliguin. I am Rob, your nurse for today, and I am in charge for your assessment of your head to neck.
I'm ready.
Now, sir, let me proceed to the inspection of your hair through palpation. I will palpate your hair, sir. Through palpation, I have learned that the patient's hair is thick and short. The hair is naturally black and no damage observed. It is shiny in appearance and the hair texture is smooth. So now, sir, I will section your hair to inspect for any infestation, infection, and problem, sir. After the inspection is I have learned that the patient's hair and scalp is healthy, no infestation, infection, and problems observed. Now, sir, I will be inspecting the size, the shape, the contour, and symmetry of your scalp through palpation. From frontal, and the temporal. After the inspection, I have observed that there were no presence of depression and nodules. The shape and symmetry is good, and the size of the skull is appropriate for his age. Now, sir, I will be inspecting your face feature. Can I request you to frown, smile, pop out the cheeks, and wrinkle your forehead? Based on my observation, the facial symmetry and the facial movement is good and normal. Sir, let me observe your facial features. As I have observed, there were moles on the left face of the patient. And there were no signs of acne, scars, and damage on the face skin. Now, sir, I will be inspecting the external and internal structure of your eye. Sir, can you close your eye for me for I will inspect the eyelids? The patient's eyelids are normal. There were no presence of lump, swelling, and damages. Now, sir, can you open your eyes for me and look up? I will inspect the bulbar and palpebral conjunctiva. The bulbar conjunctiva is white and the palpebral conjunctiva is pink, which indicates normal and no presence of lesion. Now, sir, I will inspect your lacrimal glands. The patient's lacrimal gland is normal, no signs of swelling, tenderness, and lumps. After that, we will inspect the nasolacrimal glands for any blockage. As inspected, there were no blockage in the nasolacrimal glands. Next, sir, is I will be inspecting the lower orbital rim near in the inner canthus. The lower orbital rim seems to be fine. Sir, can you cover your one eye for me and focus on an object, for I will observe the movement of the uncovered eye. Can you do it on the other side, sir? The eye movement of the uncovered eye seems to be normal. Sir, I will be shining a light to test your corneal reflex. The light reflected on the both cornea, which indicates normal. Now, sir, I will be observing it in an oblique view. The light passes through the lens and the cornea, which indicates normal and a normal response in light. Now, sir, I will be inspecting the size, the shape, the color, and symmetry of your pupil and its reaction to the light. The patient's eye is brown, the shape and the size of the pupil is normal, and the patient's pupil is contracting, which is a normal response in the light. Now I will be testing the patient's pupil accommodation. Sir, focus on the pen. As it moves closer, sir, focus on the pen. The patient's eye has the ability to focus to the pen and it is normal. Sir, now I will test your peripheral view. Can you cover your eyes for me? One eye, cover please. Sir, where do you see the object?
Right.
The right. Where is it? Lower or upper?
Lower.
Now, where is the pen?
Upper.
Okay. Let's do the other side, sir. So, sir, where do you see first the pen?
Left.
Is it in the lower or the
Upper.
upper? Now,
Lower.
okay. The patient's ability to distinguish where's the object using his peripheral view is good. Now, sir, I will be assessing your extraocular. So, can you follow the pen, sir? Cover your one eye, sir. And focus on the object. The other eye, sir. Okay, sir. I will test the 6 primary eye movement. So follow the pen, sir. Now, sir, I will shine a light to determine the location of the light reflex. The patient's eye activity and movement is normal, no sign of discomfort and awkwardness. Now, sir, I will be assessing your visual acuity. Can you cover your one eye, sir? And read the title for me.
Medical terms for nurses.
Okay. The other eye, sir? Can you read the title for me?
LPN notes. Nurses clinical package aid.
Thank you, sir. Now, sir, I will be testing again your visual acuity using the Snellen chart. Can you cover your one eye, sir? And you will read what will I point, okay?
E. P. F. G. O. P. D. E. P. L. P. E. C. F. D. E. E, B, F, C, Z, B, F, E, L, O, P, G, B, D, E, F, E, O, T, E, C, L, E, F, O, D, E, C, D, F, D, P, L, D, C, E, O, P, E, Z, O, L, C, F, D,
The other eye, sir.
E, P, F, G, O, D, D, E, D, L, D, F, C, D, E, D, E, D, F, C, Z, P, F, E, L, O, P, Z, D, D, E, F, T, O, T, E, C, L, E, F, O, D, T, C, P, F, D, P, L, T, C, E, O, P, E, Z, O, L, C, F, T.
The patient doesn't have a hard time reading the Snellen chart, which indicates good. So now, sir, I will be assessing the external structure of your nose as well as the internal. Okay, sir? Sir, can you lean back your neck? After inspecting the external nose, I observed that there is no discoloration, no discharge, and no signs of lump and depression. There's no presence of edema, inflammation, redness, and blockage. Now, sir, I will be inspecting your frontal and maxillary sinuses for any signs of tenderness, congestion, and structural abnormalities. There were no sign of tenderness, congestion, and structural abnormalities. Now, sir, I will be inspecting the auricle, helix, tragus, and lobule of your ear, and the size, the shape, and position. And I will observe any lesion and discoloration. The physical appearance of the ear is good and no signs of any problems. Now, sir, I will be using otoscope to inspect your external auditory canal for any color changes, any discharges, and nodules and serum. The other ear, sir. After the inspection, the appearance of patient's nodule, cerumen, tympanic membrane, as well as the canal is good, though there were some buildup of earwax that is needed to be addressed. Assumingly that this is a tuning fork, we will test the patient's ear with Weber's test. So hit your elbow with the tuning fork in order for the tuning fork to produce sound, and place it on the top of the patient's head. The patients must hear any sounds on both ears, and this is what we call Weber's test. Now, in ring test, hit again your elbow in order for the tuning fork to produce sound wave, and place the tongue in the mastoid process. And put it this way, and tell the patient to raise their hand if the sounds stops, and do this again on the other side. Now I will be assessing the neck. So, we must palpate the posterior triangle of the neck to the posterior cervical lymph nodes. There were no signs of lymph nodes. And now palpate the ears from back to front under the chin and to the anterior triangle of the anterior cervical lymph nodes. Palpate the left and the right carotid arteries. Palpate the trachea and palpate the thyroid gland. After the palpation, there were no signs of enlargement, tenderness, and nodule. So sir, can you touch your chest with your chin? And up. Sir, tilt your head sideways, both on your shoulders. Sir, tilt your head to left and right. Other side. The other side. The range of motion of the patient is very good because he can touch the chest with his chin and freely move his neck sideways. This video is for educational and return demonstration purpose only. I followed the procedure and the rubrics given us by our clinical instructor as best as I can, and I am happily and willingly will listen and read your suggestions and for improvements. And again, I am Rob-Denzel G, a student nurse and your future RN, and that is my return demonstration for head to neck assessment. Thank you!